All right, let's get right into it. We're going to talk about something that a lot of people might notice, but, kind of just brush off. Losing weight without really meaning to. It happens, sure, but it can also be your body sending out a really important signal. So let's try and decode what that signal might actually be telling us.
So let me ask you this. Have you ever noticed your clothes getting a little looser or seen the number on the scale go down when you haven't really changed a thing about your diet or exercise? That's the exact mystery we're going to try to unravel today.
Okay, so to make sure we're all on the same page, let's nail down the official definition. Doctors call this involuntary weight loss, or IWL for short. And we're not talking about losing a pound or two after a busy week. This is a pretty significant drop. We're talking about losing 10 pounds, or more than 5% of your body weight over about 6 months to a year without even trying. And here's why it's so important to pay attention. This kind of weight loss can be subtle, kind of sneaky even. But it can be a harbinger, basically a warning sign, of a serious health issue hiding under the surface. And that's a signal you really don't want to ignore. Now, I know what you might be thinking. Hey, doesn't everyone lose a little bit of muscle or mass as they get older? And that's a fantastic question. So let's take a minute to figure out the difference between what's just a normal part of aging versus what might be a real warning sign. And yeah, it's absolutely true. Our bodies are always changing. As we age, our body composition, that mix of muscle, fat, and bone, it naturally shifts and evolves over time. That's just a fact of life. Okay, so this is where it gets really interesting. On the one hand, a normal change is that our lean body mass, which is mostly muscle, starts to decline a bit after we hit 30, and it kind of picks up speed after 60. But, and this is the absolute key, look at the other side. While that's happening, your fat mass can actually go up. So an overall drop in your total weight for no clear reason, that is not considered a normal part of aging. That's the big distinction. So how common is this really? Well, about 8% of adult outpatients experience it, but that number jumps way up to 27% for frail folks over 65. And here's the part that really makes you stop and think. Significant involuntary weight loss is linked to an increased mortality rate of up to 38%. Wow, that's a statistic that definitely gets your attention. All right, so if this kind of weight loss is a signal, what could it possibly be pointing to? Let's do a little detective work and line up the potential suspects. We're going to break it all down into 4 main categories of causes. Now, while the list of specific conditions that can cause this is super long, the good news is we can simplify it. Pretty much all cases of IWL fall into one of just 4 main buckets. This really helps us get a handle on an otherwise complex topic. So here they are, the 4 main categories. First, malignant neoplasm. That's the medical term for cancer. Second, you've got organic causes, which is a huge bucket for all sorts of non-cancerous physical illnesses. Third is psychiatric and social factors. And finally, number 4 is idiopathic, which is just a fancy way of saying the cause is unknown, even after a thorough check. And just to give you a sense of the scale here, take a look at this table. It shows dozens and dozens of specific conditions. Now, don't worry, we're not going to go through every single one, but let's just touch on a few key examples from each of our 4 categories. So, category 1, malignant. This is often the first thing people worry about, and for good reason. Cancers of the lung, blood, digestive system, and prostate are some of the more common ones that can show up with IWL as a symptom. Next up, we have the organic category, and this is actually the most common group of all. It's a really broad category that can include anything from digestive issues like peptic ulcers to hormonal problems like an overactive thyroid or uncontrolled diabetes. And this one is so important not to overlook. Our mental, emotional, and even our social situations are all tied directly to our physical health. Things like depression and anxiety can crush your appetite, dementia can make it hard to remember to eat, and even social factors like not having enough money for food can have a huge impact. But what happens if the doctors run all the tests and they just can't find a reason? Well, that's where our 4th category, idiopathic, comes into play. And believe it or not, in about a quarter of all cases, even after a deep dive, a specific cause is never found. So that leads us to the next logical question, right? What does that deep dive actually look like? Let's pull back the curtain on the whole process and talk about what you can generally expect during a medical workup for IWL. The whole thing usually kicks off with a really thorough fact-finding mission. It starts with a head-to-toe physical exam, and that even includes checking your teeth, since dental problems can make it hard to eat. A doctor's also going to go through every single medication you're taking, ask about your diet, and get a sense of your day-to-day life. Now, based on what comes up in that initial assessment, some tests might be needed to dig a little deeper. As you can see here, this often includes some basic lab work, like a blood count, checking your liver, kidney, and thyroid function, and maybe some simple imaging like a chest x-ray.
Okay, so the investigation is done, the results are in. What's next? Let's get into the final piece of the puzzle, how this is all managed, and what the outlook, or the prognosis, generally looks like.
And this right here is the most important thing to understand. The goal isn't really to treat the weight loss itself. The number one priority, always, is to find and treat whatever is actually causing it in the first place. The treatment plan can look really different from person to person. Of course, it starts with treating whatever condition was found, but it might also mean changing medications that could be hurting your appetite, using nutritional supplements to get more calories, and even starting an exercise program to build back that lost muscle and strength. Now, I want to share this quote directly from the source material because I think it's a really powerful and, frankly, a pretty reassuring final thought. For that 25% of people where a cause isn't found, their outlook is generally better than for those where a cause is found, especially when that cause is cancer. That's a really hopeful piece of information. So when we boil it all down, what's the big takeaway? It's actually pretty simple. Unexplained weight loss is not something you just ignore and hope it goes away. Your body might be sending you a really important message. The best thing you can do is listen to it. And really, that just leaves us with one final question to ask ourselves. It's not just about weight, but about really being in tune with our bodies and taking charge of our health. So take a moment and just ask, what is my health telling me?